Hello everyone, let me introduce to you Dr. Livingston, who is going to demonstrate the technique of performing sterile procedure.
The first step in preparing your central line placement is preparing the space around the patient. The first thing you want to do is open the trash can and keep it open. It'll serve you well as you go through the procedure, trust me. So in every kit in the ICU, you're going to find third drawer down a saline flush. Grab one of these saline flushes, don't have to open it. Open the trash can and put the saline flush here into the hinged part of the trash can so it stays open for you. That'll be extremely useful later on. Just put it here at the foot of the bed. Be sure, we'll come back to that in a second, be sure you have all of the necessary items. The first item being, of course, the central line kit itself. You'll see it's a 7 French triple lumen kit. You'll know that this is the right kit because it has bubble wrap on both sides with your sterile flushes. Your next item is going to be, of course, your gown, which this kit already contains 2 gowns, but always have one on standby. Have an additional ChloraPrep wand. One is already included in here, but have an additional one. Grab your sterile gloves and your probe cover and a chucks. The nurses will very much appreciate this. The chucks will go under the area of insertion, under the patient. And then lastly, of course, you need your bedside table, a properly functioning bedside table that you'll put next to you as you prepare your line before you prep the patient. Is to open up your gown and your gloves. Again, gowns are already provided in this kit, so you may use this kit's gowns if you want. So I'm just doing this one for demonstration purposes only to avoid opening the whole kit. So we open up our gown and leave it like this. Remove the gloves and fillet them open onto the table. Like this. So they'll be ready for you when you come back. Now you want to remove all jewelry and wash your hands. That's how the trash can comes in handy. So now reach in and grab your gown. And when you grab your gown, you see these 2 areas on each side you can put your thumbs right into, here and here. And once you put your thumbs in there, the gown will unfold by itself. And when it does, you'll be able to grab the Velcro pieces at the collar and wrap it around your neck and attach the Velcro behind your neck by yourself. Bring your hands back, under and up into the arms without pushing your hands through the cuff. Keep your hands before the cuffs here and grab your gloves using the gown only. And now, carefully, hook your finger into the first glove and bring your fingers up through the glove, like this. So you see how most of the gown is across the palm of my hand. You can adjust this later once you get the other glove on. And now with your gloved hand, you grab inside the cuff of the left glove, put your fingers in through the cuff like this, and pull it up. And now you can put your left hand into the left glove and push your fingers through. Pull the cuff of the glove up as far as it goes like this. And now with your right hand, you can pull the cuff back that's kind of trapped inside your glove like this to make it a little more comfortable. And again, with your left hand, you can move the cuff up and adjust your right glove like this. Okay, you can see the central line kit is now unpacked, and I had my colleague just put this on the table for me. Now I will open the kit, and you see there are 2 masks here already, which we don't need readily, so I'll set those aside. In order to open the kit, you want to pinch from the outside and pull down. And again, from this side, pinch from the underside and pull over. and unfold, leaving the sterile field sterile, of course. Here are the two gowns that we mentioned already. I will grab those and set them aside. One is for you, and the other is for your assistant. Let's set those aside for now. Before we open it, you see there's a little ChloraPrep inside, which you can simply open and leave on the sterile field like this. And I'll throw that away. And the second package then is going to be the central line kit itself. So within this kit, we have the drape, the sterile drape, which I'll set aside for right now. You have your sterile dressing. Again, I will set that aside for right now. A 4x4 gauze, lidocaine to prep the patient, the primary things you want to make sure of are, one, your guide wire is ready to go. And the two things with the guide wire, number one, ensure that the coned tip is near the very end of the guide wire, like this. If you don't do that, the guide wire is going to be very difficult to push through into the catheter. So ensure that coned tip is advanced up over to the tip of the guide wire. Secondly, pull the guide wire through so you feel no more resistance. So it's very easy to move into the catheter. Now that that's prepped, I'll set it aside. Next is your central line. This is the central line itself. You have 3 ports, as you can see. One distal port, which is always the brown port, and coming directly from the middle, right here. This is your distal port through which the guide wire will be placed. The white port is your proximal port, and the medial port is the blue port. In order to prep this, you need to flush it. Remove all the caps from the ports and place the blue caps onto every port. And now you're ready to flush the line. Always flush the longest line first. In this case, it's going to be the proximal port, the white one. Simply have your syringe faced up so the bubbles come up to the top and flush it, and you can see here the saline is coming out the proximal port. Hard to see on the video, but you'll see in person. And then the middle port is your blue port. Flush that, ensure the saline is coming out. And lastly, your distal port, which is the brown port, is flushed. Sorry. And that is prepped. In order to apply the sterile drape, one good idea in order to remove this adhesive tape is to fold it backwards, like this, along this axis. Head is facing up, as you can see, and it allows you to remove the tape very easily. Once you do that, you'll be able to place it directly onto the patient's neck or subclavian site and unwrap it, or the femoral vein, and unwrap it following the direction of the arrows. This arrow coming out toward you, this arrow coming toward me, and this arrow going to the patient's head, and so on. Now that we've opened up the sterile drape, you'll find a fenestrated area underneath this blue square. Simply remove the blue square and throw it away. And take your ChloraPrep, the second ChloraPrep application, to sterilize the field. You'll then apply the lidocaine to the site of insertion. All right, now our central line is placed. As you can see, all blue caps are on, but you'll see that it's hanging over our sterile field area. And we want to apply our sterile dressing, so what do? You see where it says to tear here. In this perforated area, zone here, you can simply lift up these tabs and tear it open. And next, you will apply your sterile dressing. And notice the sterile dressing, or what they call the central line dressing, has a chlorhexidine patch on it. And this chlorhexidine patch lies right over the site of insertion. And from this point forward, have additional assistance from your nursing staff.